very much, Nils, and thank you very much, Stan, for having me here today. I'm very pleased and honored to have the opportunity to comment on public choices, private decisions, sexual and reproductive health, and the Millennium Development Goals from a non-governmental organization's perspective. This is a great opportunity for Engender Health, an international NGO that has worked in the field of family planning and reproductive health services for more than 60 years, and for me personally. For some time, NGOs, professionals, and activists strongly committed to the post-Cairo agenda have been losing grounds in terms of visibility and resources. The reasons are manifold. The lack of an explicit reference to sexual and reproductive health in the MDGs has certainly contributed to the relative invisibility that affects us today and to the slowing momentum. As Jeff recommended, we are trying to be calm, but still, all opportunities to highlight the links between sexual and reproductive health and the MDGs are critical. The UN Millennium Project and Stan Bernstein and Charlotte Hansen's report fill an essential need. The authors present compelling data about the inextricable links between the two agendas and articulate the arguments that make totally and absolutely clear that the MDGs and the Cairo Program of Action are not only compatible but synergistic, and that in order to achieve the 2015 goals, both agendas will have to be addressed simultaneously. Progress towards the MDGs will not be possible without the engagement by all key stakeholders, governments, international bodies, donors, academics, and NGOs. For more than 4 decades in the field of population, family planning, and broader sexual and reproductive health and rights, NGOs have been the forefront of promoting new approaches, encouraging international bodies and donors to embrace and support them, and convincing governments to take action. At all levels, international, local, and national, NGOs have undertaken advocacy, training, education, and community mobilization, and have monitored what has and has not been achieved. NGOs have taken the generated evidence to hold governments and aid and international agencies accountable. We like to think of ourselves as the voice of the people we serve. The NGO community has accumulated experience that is invaluable to achieving the MDGs, goals, and targets. In fact, there are many examples of the vital role that NGOs can play in each of the 5 priority tasks identified in the report. Task number 1, integrating sexual and reproductive health analysis and investments into national poverty reduction strategies. International and national technical NGOs have for decades been at the forefront of research in the areas of family planning and sexual and reproductive health. These groups are well positioned to expand their focus to collect the data on health, other health issues, education, and gender, to orient investments and to estimate the impact of particular strategies aimed at achieving the MDGs. Local activist groups can then use this evidence for well-informed advocacy purposes. Task number 2, integrating sexual and reproductive health services into strengthened health systems. For more than a decade, sexual and reproductive health NGOs have focused on the integration of vertical programs, namely family planning and child survival, into comprehensive primary health care models. Governments should take advantage of this expertise when they engage in efforts to upgrade the capacity of their healthcare systems. Task number 3 in the report, systematically collecting data at the health system level to assess progress towards targets, improve management, and ensure accountability. For several MDGs, this task requires the national information systems disaggregate data by sex, and that governments be interested and capable of looking at this data with a gender focus. Some sexual and reproductive health NGOs are poised to provide the required technical assistance and create awareness about the importance of gender-sensitive analysis. Task number 4, acting on the Reproductive Health Quick Impact Initiative. This UN Millennium Project initiative has 2 components: improving access to reproductive health information and services, and closing the funding gap for commodity supplies and logistics. For decades, NGOs have focused on improving quality of care and mobilizing communities, and have struggled to ensure contraceptive security. We are ready to apply this knowledge to a broader range of sexual and reproductive health issues. Finally, task number 5, meeting the needs of special populations. Over many years, sexual and reproductive health NGOs have accumulated experience, knowledge, and tools to work with the same underserved and vulnerable groups who the MDGs have identified as their target population. This is an area where NGOs could make a substantial contribution. In conclusion, we are well positioned to be key players in all efforts towards the integration of sexual and reproductive health in the MDGs. To make this happen at the national level, some very important challenges will have to be overcome though. First, there is an important difference between the Cairo and the MDG movements. While civil society organizations were deeply involved in the preparation for implementation and follow-up of the UN conferences of the 90s, and were consequently recognized as partners and natural stakeholders, the Millennium Declaration was a result of a different process, where NGOs were not deeply implicated. As a consequence, the MDGs are still largely unknown by most national NGOs, and there isn't the same sense of ownership as citizens groups have on the sexual and reproductive health and rights agenda. Therefore, international NGOs with solid national partnerships and networks have a distinct role to play by educating sister organizations on the current development framework and how to articulate the arguments that demonstrate that sexual and reproductive health and rights are integral components of the MDGs. In addition, national NGOs must also overcome other monumental barriers before being able to fully participate in the fight against poverty. They will have to refocus, to learn a new language, to first defeat their own skepticism and then that of the communities they serve. They must find a niche in an increasingly conservative and therefore hostile environment, and to maintain a focus on an unfinished agenda with decreased financial resources. So, how do we assure that NGOs have a seat at the development table? Several important efforts will have to be made, and public choices, private decisions, represents a very valuable step. This report will empower NGOs and better prepare them for an active role at the country level, which is where the difference will have to be made. Thank you very much.